Hello, everyone. Thank you so much for helping in. It's great to meet you here. Happy New Year to all of you. If it's your first time meeting me, my name is Ranto Minyema. I'm a medical student and I'm in my third year studying medical radiography. And apart from my medical studies, I'm also a medical content writer. So today, all med talks with Andrea. So, hey, Andrea, could you introduce yourself to the audience?
Hi everyone, my name's Andrea. I recently just graduated from medical school at American University of Antigua over in the West Indies. I am applying into pediatrics this year, and I am also first generation, non-traditional, and yeah, I'm just happy to be here and talk to you guys. And nice to meet you. Thanks for having me.
You're welcome. You're welcome. You're welcome. So talk us through how is 2023 for you and what is your resolutions for this year?
Oh, 2023 was great because it's the year that I finished medical school, and it was just such a big relief and accomplishment for me. Um, so I can't complain in terms of academics or anything like that. So everything was good. And for 2024, resolution is to just stay healthy and, well, be happy, and of course to hopefully match into pediatric residency. Just accepting whatever path comes my way at this point.
Yeah, definitely, definitely, definitely. All right. So are you ready for these questions, for you
Yes,
to enlighten the audience? You're okay.
I'm ready.
Sure, definitely. So the first question goes this way. As a first generation Latino medical student, what inspired you to pursue a career in pediatrics?
So what inspired me was I had a little bit of a non-traditional path. I worked for a while first in some labs, and I realized that it wasn't what I wanted it to be. I felt like something was missing. And also growing up, I saw that as immigrants, it's not just Latino or just any immigrant speaking another language. Getting that medical care across is difficult. So being a child and having to translate to your parent is a difficult task. And telling a 7-year-old having to tell their parent that they have a thyroid condition or whatever it may be, that shouldn't be happening. So I really wanted to bridge that gap and wanted to provide medical care for children in their native language so parents could also understand. And I was a patient myself when I was younger, and that happened to me when I was younger when I moved to America. So I just wanted to bridge that communication gap and be able to treat people in Spanish, specifically children.
Amazing, amazing, amazing. So, what do you have to tell people that are considering to pave that path to pediatrics? What is your advice for them?
Well, my advice first to anyone who wants to do medicine is you have to be 110% sure you want to do this. This is really a lifelong commitment. It's not just a job, it's really a lifestyle in the way. So you really have to be sure you want to do this. And in terms of pediatrics, well, in pediatrics, a lot of people, confuse it with, oh, it's just kids and they're screaming and all they have is the sniffles. But in reality, pediatrics is really holistic. You're treating the kid, but the parents also have questions, and you're really talking to them. So it's children and their parent and their whole family as well. So it's a package deal. So if that's what you're interested in, I originally was not even interested in pediatrics. It was something that I saw as I went through medical school, and I really wanted to fill in that gap, like I said before. So just give yourself time to really see what your calling is. Really be open to all specialties, and one day I promise it will just click. Sometimes it takes a little bit longer, but one day it will just say, "Hey, this is it. This is what I want to do." And pediatrics was the one time that I didn't even want to go home. The doctor was like, "Okay, your time's up. It's time for you to leave now." And I'm like, "No, I like to be here." And that's when I was like, "Oh, I think this is it for me." So it will click. Just give yourself time. Just be patient, and just you don't have to be smart in medicine. You just have to work hard.
Yeah, hard work really pays.
Yes,
Thank
it
you so
really
much. For,
does.
yeah, absolutely, absolutely. Thank you so much for that tip. So before we go into the second question, could you talk us through, the diseases, children face nowadays and how to, overcome those types of diseases in your own perspectives?
Yeah, so a lot of diseases for children. Right now, we have a huge RSV surge and the flu, adenovirus. So unfortunately, those things are really hard to prevent. Luckily, right now we have that RSV vaccine that just came out. So we'll see how that improves some statistics, maybe for future winters here. But I think in terms of prevention, that's really the tough part to prevent because kids are always at daycare, they're always around other kids or family members, especially now in the holiday season. Everyone's, touching their hands, kissing them, and it's just it spreads like wildfire. So just make sure everyone's washing their hands, make sure everyone has that flu vaccine. Once the RSV vaccine becomes available, everybody, getting that done. And of course, if there's any questions with kids, a lot of times parents come in when things are a little bit too late. So it's better to come in and see your pediatrician when you have any questions. It's better to be safe than sorry because once it's a little bit too late, especially in developmental issues or anything like that, there's nothing pediatricians can do if it's too late. So even if it's something minor, it's better to just call your doctor and and ask them and make an appointment than have it coming in too late and they're not able to help you at all. So I think those are the two things. Mostly developmental issues are things that we've been seeing, and of course that RSV and flu surge that we have up here. Just because I'm up in the north, New Jersey, close to New York, and we have a strong winter coming. So
Yeah, thank you so much for expatiating on that. Um, I believe the audience grabbed something off from what you just said, you know. So the second question goes this way. How does your culture, influence your approach to patient care? What is your take on that?
So culturally, I think it's very important just because like any culture, we treat things differently. So I know, for example, even just an example, just the technician that does, my nails, she's Hispanic and she asked me, "Oh, my son has asthma, but I treat it with herbs." And in Western medicine, we're not used to using herbs. We're used to using albuterol, like the pump, the inhaler, and things like that. So a lot of people may just say, "Oh, she's not treating her kid or she's neglecting her kid," when that's not what she's doing. She's trying her hardest to treat the kid, but maybe she wants to try other avenues first. So I think being understanding of other cultures, and that there's certain things. I think holistic and nutritional and all of that is definitely helpful and something that you have to respect with other cultures. But of course, adding the medicine is, of course, helpful. So I told her, you can use the tea if it's helping him, but make sure you're also using his inhaler. So just being respectful of both cultural and the medicinal part as well. And same thing with, there's certain things like I'm not sure if in your culture, if you walk outside with your hair wet, you're gonna get sick, or if you walk with barefoot, you're gonna get sick and it's too cold. Things like that. So it's just something um, to bridge that gap and not necessarily negate it. Just say, hey, I understand and I understand where you're coming from, but why don't we try both things? So that way you're not dismissing the person's culture, but at the same time, you're also adding the medicinal part to it. So I think that's very important, not just for the Hispanic culture, but for any culture, for Asian, African, everybody has their own, medicinal views.
Absolutely, absolutely. That's when adaptation comes in. You just have to adapt to different cultural diversities out there. Thank you so much for that. So the third question goes this way. Before we move into the third question, what are the latest advancements or latest technologies used in the treatment of children's diseases?
So for latest advancements, the one that I know right now is the RSV vaccine that's coming out that I mentioned before. unfortunately, I work at a clinic right now, and the clinic is a community clinic, so I believe it's a little bit expensive. So unfortunately, we haven't gotten that yet, but I know it is becoming widely available. It has proven to be very effective, and I believe also adults that are, I believe, don't quote me on this, but they're 65 and over, and if they're immunocompromised, they're also going to be able to get it. So that is the latest that I've heard. Um, but of course, things are always evolving. But that is something that's very exciting because from what I hear, I'm not a resident yet, but from what I hear with my colleagues, RSV is really what really takes up most of the beds, especially during the winter time. So hopefully we can get those numbers down and prevent any complications from that. So that's actually the latest that I've heard right now. Of course, if anybody knows of anything and they want to comment on it, that would be awesome. I would love to read those comments on that.
Amazing, amazing. That's cool. Thank you so much for explaining that for us. So the third question goes this way. Are you ready?
Yes.
So you've graduated from med school, and that's amazing, Andrea. So can you share some of the key challenges you faced in med school and how you overcame them, especially given your unique perspective, as a first year medical student looking to learn about treatments? So what is your take on that?
Yeah, so not everybody, but some of us do have to move away from home, and that was a big challenge. I moved to Antigua. It was a new country, a new culture, everything I had to learn. I loved it. I go to Antigua once a year now. I consider it home, so it was great. But I think that's a challenge that anyone has to, if they move away from home, even for residency or whatever it may be, that a challenge that we have to learn to overcome once in our lives, most likely. But I would say in medicine specifically, going from studying as an undergrad, I know not in every country you have to do undergrad, but still going from, high school or undergraduate to studying medicine is a huge jump. So I used to study maybe a couple hours a day and that was enough. But in medical school, I studied 10, 12 hours a day. I had all these different resources and you have a whole bunch of classes and you have to tie things together. And even though I had great professors, a lot of medicine is self-learning. And that's something that I really had to learn and I really did struggle with because I'm not a great test taker. So that's a challenge I had to overcome, especially the beginning, because the way Caribbean medical schools work is that the first 2 years, and I believe US medical schools as well, is very theoretical based. So everything is textbook. And the last 2 years is clinical. So it's all hands-on. You do have exams, but it's based off of the hands-on learning that you're doing. So I thrived way more in the clinical aspect because I was able to see if there was a patient with diabetes, I could physically see the patient with diabetes, make a treatment plan, see what the patient was being given. And then later on in my test, I was like, oh, it sounds like Mr. X. And then I was able to relate the question to that patient. But at the beginning, it's tough because all you're doing is just reading a textbook and I wasn't really putting things together. So the way I overcame that, which worked for me, I know it works differently for everyone. I found a solid group of friends and we discussed things. Or sometimes they would just quiz me randomly. We would be at dinner and they would say, okay, what's the pathophysiology of diabetes? Go. And sometimes I realized I wasn't learning things properly on my own. And the person would be like, you know what, that's actually, you're on the right track, but that's actually not right. It's actually this. And I'm like, oh, wow, this whole time I was reading the same thing over and over again and processing it incorrectly. So that's something that really helped me. Or if I didn't have anyone, I would just talk to myself and use a whiteboard and really draw everything out and try to bring everything together. And of course, questions. The famous U world is really really key there. But I think honestly, just having a really good group of people to review with, even through Zoom like this, we used to do that as well during COVID. We would meet over Zoom and just study with each other, even if it was in silence. Sometimes we would say, hey, by the way, even though it's been quiet for 5 minutes, I have a quick question on this. I don't really understand it. Um, so that's definitely that. And if you're doing questions, make sure you're not just reading the answers. You're actually looking at the answers and researching them. Even if it takes you longer, it's really going to help later. And that's something I didn't do at the beginning, and I wish I did. Um, So definitely make sure you do that. Sorry, that was a very long
Absolutely.
answer.
Yeah, it's fine. It's so amazing. Like having a supporting system, like a backup system, is very essential. And thank you so much for telling us that, and for telling us your challenges and how you overcame them. That was amazing. Thank you so much. So, you ready for the fourth question?
Yes, sir, I'm ready.
All right. So, what specific experiences or changes as a medical student that made you to be passionate about pediatrics? What do you have to say
So
about
the
that?
so for me, I think it was I actually did a so I'm originally from Venezuela. I speak Spanish. However, um, just like many people that are bilingual, trilingual, whatever it may be, there's medical terms that we don't use frequently. And simple things. Someone asked me how to say a port, like where you put the chemotherapy through. I had no idea how to even say that in Spanish. And I realized, I'm not fluent. I'm fluent in Spanish and I can read and write it, but I'm not fluent in medical Spanish, and that's really important. So I decided to do a rotation in Puerto Rico, which was really great. Everything was in Spanish, and because it was underserved, even though I was a student, I was doing all the doctor work. I was putting in orders. I was seeing patients by myself. It was a great experience, and it was a pediatric um, intensive care unit rotation, and I became really attached to one of the patients. She had a very rare disease um, called acute disseminating encephalomyelitis, and she was fine one day. She was at recess, and next thing you know, she wakes up and she's quadriplegic. She's on a ventilator. She can't nothing. She can't eat. She can't speak on her own. She can't move her limbs, and it just happened very suddenly. And I was there for a couple months, and I just saw her progressively get better, and made this relationship with her mom, who was pretty much living there with her. And that's when I realized that this is for me, and I that was the experience that really changed everything. And when I came back and I was able to speak that medical Spanish, the face that people made when they saw someone that looked like me, that sound well, I don't really have an accent in English, but in Spanish I don't have an accent either, so they were just so happy to see someone um that spoke to them, because they would just say, oh, sorry, no hablo dolor aquí, and then they would just point, and that's not really how you want to, that's not saying anything, just someone pointing somewhere. You need to follow up questions. And through a tablet, it's also not the same. I've heard people translating on tablets, and sometimes the point doesn't really get across as it does face to face. So just seeing people, light up when you walk in and you're like, wow, this is someone that can communicate with me, who looks like me, who is going to understand that, I'm not crazy when I say that I use Vicks all over, and that's how we treat things in our culture. We just put Vicks and we hope that it works. And that's normal. Or we drink some tea and we hope that it works. And no judgment. I understand. My parents do that. My grandma does that. It's okay. Um, so that's really what it took me a long time. It took me until the very end, and I was like, this is it. So it was really a mixture of experiences, but I really enjoy it.
Amazing, amazing. That was amazing, Andrea. I love the fact that you're pursuing your passion. You're hitting the nail on the head, and you're just moving, without looking back, and that's cool. That's cool, and I believe that the audience will definitely learn something from you. So the
Thank you
fifth
so much.
question goes this way. Yeah, definitely. How did these opportunities, you came across your path, shape your desire to work in the field of pediatrics?
So I think it's shaped, I think it's also important to give credit to not just my experiences, but it's also important as you go through medical school that you find mentors, people who have been in the field. And I mean, luckily for me, it was somebody with the same background as me. But it doesn't obviously it doesn't have to be. It could be anyone that you feel comfortable with. But I think that that really shaped what I wanted to do, is having a really strong mentor in the field. She's a pediatrician. She's in emergency medicine. She's Hispanic like me. She's first gen like me. She also struggled during exams. So unfortunately, one day, as many of us may know, I had a hard day. It was a hard time, and I asked her if I just needed a minute, and I went outside, and I was actually crying. I don't know why. I just started crying. I think it was something about an exam, I think. And she came outside and was like, "Hey, you're not the first person to do poorly in an exam. I did poorly in an exam, and look at where I am. Just because you did poorly in an exam, or you failed an exam, there's many opportunities to come, and that doesn't mean you're a failure. That doesn't mean you're not supposed to be here." Um, and then she opened up to me about, she failed an exam, and she was also a first gen, and I had no idea. I didn't. You just see a doctor and you think, oh, this was easy for them. They're where they're supposed to be, and that's it. Um, so it was very nice that she opened up, and she ended up actually becoming a friend. I'm a bit older, so we're actually almost the same age. So she became a bit of a friend. She actually just had a baby, so she sent me a picture of her baby. She wrote my letter of recommendation. She really guided me through the whole process. She even did practice residency interviews with me. She helped me out. So I really think that aside from the clinical experiences and the cultural experiences that I had, it's important for everyone to find a mentor, someone who has been through it, who it doesn't necessarily have to be in your specialty, but maybe someone who also had a hard time in medical school or whatever it may be. But find that support, as you were saying before. It's so important to have that support, not just with students, but as an attending or another resident that will mentor you through. It is very important, and I really thank her for getting me to where I am. And she really did inspire me to become a pediatrician just like her. So if anyone ever asks me at the hospital, what do you want to do? I'm like, I want to be just like her, and that's all I say. So that's really important. So I highly suggest that. And she really did shape my desire to become a pediatrician as well, on top of all the other things.
Amazing, amazing. That's cool. Whoa, you've been an amazing speaker, Andrea, and thank you so much for answer these questions correctly. And I believe that the audience will really grab something and learn something from you and from our discussions thus far. So, do you have any advice for the other first generational Latino medical students out there? With your like dealing with similar challenges, not only for generational Latino, because different people are going to come across this video from different varieties globally. So, what are your advice for them with similar challenges and how to overcome them?
Absolutely. So I'm sure other people have been told that their medicine is hard. Maybe they should change their career. Maybe that they shouldn't do it, or their GPA isn't good enough, or your degree from whatever country you're from isn't valid in the US. It's just a lot of things that, yes, those are added challenges. I am going to start residency next year at the age of 33. Most of my colleagues are in their mid 20s. So it's not, and people ask me, are you having kids? What are you doing? And it's not, just go your own path. Just no, it doesn't matter what anybody says. Your path is just as valid as anybody else's. Whether you start medical school at the age of 20 or at the age of 30, if that's what you want to do, that's what you're going to do. If somebody tells you that, oh, your grades aren't good enough, your GPA is not good enough, and you try, then find different ways. I know some people did some extra courses to boost their GPA, and then they went into medical school, or they did some research, and the research, sort of complemented the GPA, which was a little bit average, and they just increased their chances of getting in that way. If it's something you want to do, do it. Don't pay attention to anybody else if they're telling you not to. Don't pay attention to anybody else's timeline. It's not your timeline, and there's a reason why your timeline is your timeline. If I wouldn't have gone to medical school at this age, I wouldn't have even met my partner. I met my partner in medical school. So it's everything's supposed to happen for a reason, even though you may be down at that moment that you didn't get into your top choice, that you have to take a gap year. I'm in a gap year right now. Everything happens for a reason. I know it's cheesy. I know it, but I'm saying it because I've failed. I've had to take gap years. I've had people tell me that I should change my majors. I failed classes in undergrad too. Chemistry is not my friend. I'm really bad at chemistry. Um, and just if that's what you want to do, you can do it. Find yourself a mentor, a support. You have us here on Instagram. You can or email. You can definitely reach out. We got you. It's a long process, but don't listen to anybody else and don't compare yourself to anybody else's journey. Your journey is your own, and I promise you that the destination, if it's medicine, it's going to be worth it. Even if it takes you longer, even if you start later, I promise everything will work out the way it's supposed to. So that's my take.
Absolutely. Absolutely. That's an amazing tip, honestly. Like that was so deep, like really deep. Um, thank you so much for sharing that with us. Thank you, thank you. So you mentioned earlier that you had a mentor, and that's amazing. Now, I have two questions in that.
Mm-hmm.
How did you get the mentor? How did you talk us through how you got to meet your mentor? How did you realize that this person is going to be my role model? And what is your advice for people, in search of role models and their various medical careers out there? What is your advice for them?
So while I was doing, she was actually my attending or my preceptor during my clinical rotation. As many other students, we have lots of preceptors. We come across a lot of attendings, but something with her just seemed to click. I just felt very comfortable with her. Um, so and that it was just sort of it's like meeting a new person, you like a new friend that's your age. You sort of just click, you're like, okay, this person seems like we can be friends. And that's what happened with us. Luckily, she was my preceptor at the time. However, I do know people that find mentors on Instagram or find mentors through different programs. I know there's a Latin Medical Student Association. I used to work with them as well. And what they do is they pair you up. If you're a pre-med, they pair you up with a medical student and you guys can talk on the phone. You guys can FaceTime. You guys can send emails, whatever works. I even looked over somebody's personal statement. So definitely just reaching out. If you feel like somebody on whether it be Instagram or whatever it may be has similar likes to you and you reach out to them. I mean, what's the worst thing that can happen? They say no, they're too busy. And that's it. You just move on to the next, person. But check out your preceptors, whoever you're rotating with. Ask them for career advice, and sometimes it goes a little bit further than that. And just check out Instagram and different medical student associations. They have some great mentorship programs.
Wow, amazing, amazing, amazing. So, wow, yeah, that's group you're talking about, medical association, is really helpful because I mean a lot of them, and it's really impactful to me, and that's cool. So you just have to just, like she said, just go for it. If you didn't get a response from the person you just tested, maybe that person is not right for you. You have to keep going until you get the necessary mentor you need. And that's really amazing. So the last question goes this way. Wait a minute. Why are you so interested in pediatrics? Why didn't you consider um, cardiology, neurology, radiology, and other medical specialties out there? Why pediatrics? Tell us why.
So pediatrics, I chose it because I realized that and this is, I don't know if this is going to sound bad, but when I had adult patients, sometimes adult patients are very stuck in their ways. So they're very stuck in their ways in the sense of, can you please take your medication? Please take your medication. You, of course, ask, can you afford the medication? Can you get to your medication? There's other factors, of course, as to people why they're not taking their medication. But if the patient just doesn't want to take it or is not complying with the plan that you're giving them because they don't feel like to me, I became very frustrated. And I know that a professional, like I would be very frustrated with my patient, and I can't be frustrated with my patient. I have to be very polite with my patient. And I know that's something that I was not going to be able to handle very well because I know myself. I was just going to say, just take your medication. I'm telling you something, after they've come in 10 times and I just keep repeating myself. But with a child, it's not their fault. If they're not taking their medication, I can't be mad at a child. It's not their fault. Maybe they don't understand how to take their medication, or they ran out and just forgot to say something, or they were playing and forgot, or it's, I don't feel that, not blame, but I just don't feel that upset when when a kid does that. So I just feel like it's so much more innocent. if that makes sense. It's never the patient's fault when in pediatrics. It's always that. And I'm not blaming any adult for their illness. I know that most illnesses are not anybody's fault by any means. But sometimes I say, okay, well, you have this condition, you have diabetes, but you just had a whole bag of chocolate. And we talked about this already. So things like that. And I know I don't have the patience for that, but for some reason I have more patience for children. So I know that sounds really silly, like a really silly reason as to why pediatrics, but I at least know myself and I know how I can provide the best care.
Amazing, amazing. That's cool. That's really cool. That's really cool. You know, as a medical student like me, studying radiography and also a medical content writer, it's really, you know, it can make someone go insane just doing a whole lot of works, because if you're going to med school, you don't need to do all the things. You need to focus because med school is going to take almost all of your time or something. But there are times we get depressed or you get burned out or stressed, something. So, to end up this session, how did you handle burnout or stress, or how did you handle these, daily perceptions, and what are your advice for people that are suffering from depression, burnout due to their schoolings or something like that?
So we always have that guilt when we're not studying. Every time we're doing something that doesn't involve studying, I feel extremely guilty. Um, and that's always going to be there. I'm not going to say that's not going to happen. But I found things that I enjoyed doing. So I actually, while I was on the island, there was a stray dog that kept coming to my house and she never left. So I adopted her. So what we did is that I also enjoyed the beach. She enjoyed the beach. And I used to plan an hour of the day where I would take her for a walk to the beach. We would sit at the beach and that hour was blocked off. Once I came to the US, unfortunately, the beach is extremely cold here and it's not as nice as the Caribbean. So instead, I would just take her for a walk, a nice long walk, or I would go to the gym for an hour. There was an hour blocked off for me whatever I wanted to do to just de-stress in the middle of the day and then come back to my studies. I also like to take one day a week off, unless of course I'm studying for a step or something like that. I take 1 or 2 days off a week, like the weekends I just take off. I go out with friends, watch a movie, or just stay home and try not to think about work or school or anything like that. And that really helped me. And of course, when I was stressed, I would talk to my friends that were also in medical school, because a lot of people that are not in medicine don't necessarily understand. Sometimes they just say, oh, step, that's just an exam. And you're like, okay, that's not just an exam. It's an exam that was $1,000 and 7 or 8 hours and determining my entire career in the US. So it's not just an exam. So sometimes talking to people who can relate and really blocking off some time for just yourself, even if you feel guilty, just as you say that you have to do 40-year-old questions a day, you have to take an hour of your time. It's just as mandatory. And that's what I did. I didn't do it at first. And as you said, I was getting very sad. I was sad to be away from home. I didn't feel like I had that support. And then I was like, you know what? Screw that. My mental health is more important. If my mental health isn't there, I'm not going to study well. So it's one thing after another. So just take a time, take a block, take a day if you need it. And if you need it, you need it. If you're burnt out and you're like, oh my God, I'm so behind, that's fine. I know it's awful, but take the day off and you'll come back to
Absolutely.
it tomorrow, because you're not productive, you're not productive if you're burnt out.
Yeah, absolutely. If you're stressed, you can't do anything. You just pay more attention to your mental health. It's really important. Very, very important. Hey, we've come to the end of the session, and you've been an amazing speaker. So, what are your last advice before we round up the session?
Last advice is just reach out. Honestly, I think the biggest takeaway from all this, after saying everything out loud, is really the support system has been the most impactful. So reach out. Any questions you have, put them in the comments. We can both answer them for you. Uh, Shoot us a message. We can both help you out wherever you are in the world. Um, really find that support system and take that time for yourself, because being burned, we need you here and you're here for a reason. And Just stick with it. You got this.
Definitely.
And really just enjoy the ride. You know, it's really not as bad as, I know it's stressful, but enjoy the ride. It's actually really fun.
It's really worth it, you know. It's really worth it. And you heard what Dr. Andrea said about, you know, she's willing to help. So make sure, you know, you're gonna put how you're gonna reach her, you know, in the description below, where you can reach out to her if you need anything. If you need some support or some inspirational words or something, just reach out to her and she's gonna help you. So if you like this content, do well to subscribe, like, and share to your network. Hopefully this video is gonna touch someone. Thank you so much.
Thank you so much for having me. Bye,
You're
everybody.
welcome.
Thank you. Thank you. This was lovely. Thank you so much.
Yeah, it's the record.